So this patient of mine, she didn't want to come on the show. So I wanted to. I think it's. I want to talk about her case though, because I think it's important. I first saw her a few years ago. She was sent to me by her mother, who is a patient of mine, and her mother's had really great results with seeing me. And so. So anyway, she came in, has a long history of anxiety. She had a really tough childhood. She was sexually molested at 7 years old for about a year by a neighbor. She had her parents divorced when she was younger. Her mom was an alcoholic growing up. Her father when he got remarried, she didn't, his new wife, she says, didn't like her and they didn't get along. So very difficult upbringing. And so here she is in her mid-20s, suffering a lot. And she had tried, anyway, she has, I mean, I can go through a long list of what she told me, but, she's like worrying, rumination, meaning just constant worry and obsessing about things, anxious, depressed, low motivation, low energy, poor sleep, nightmares at times, and reliving a lot of past trauma, and she also had a lot of physical symptoms: headaches, neck and shoulder tension. She'd been told she has irritable bowel syndrome. A lot of bowel issues. Chronic pain issues. A doctor told her she had fibromyalgia. So she was a very miserable person when I first saw her. And I knew what her mother had success with. So I had a kind of an idea because of the genetic factor. What I see was sometimes with genetics is whatever, like a parent, let's say, does well with her sibling, it's a starting point. It means that possibly the same medications we're going to work on that person. Not always, sometimes, because everyone's an individual. Some people need different things. But I kind of had an idea because all of her symptoms kind of pointed me in the direction that I had success with her mother. And she had tried at one point. She was kind of anti-medication for a while because I think a doctor gave her some Prozac. Prozac's not a bad medication. I have some people on it, but it made her kind of feel apathetic and flat and emotionless, and which is a problem with SSRIs. With they can do that. Sexual side effects, fatigue. So I mean, it can help, and then some people have no side effects. And so not to disparage the medications because it's not a problem with everybody, but in her case, so it kind of turned her off, and she went a while saying, "I don't want to take anything." So her mom finally talked her into seeing me. So what I put her on? If you've been watching the show to this point, you probably have a good guess. I put her on Pristiq, which is what her mom did well with, and dramatic within a week. With just the first days of taking it, and by the next second visit, I've been seeing her for, like I said, for a few years now. She was dramatically better. All the symptoms I just said went away. Her sleep was improved. Her anxiety was gone. She wasn't worrying about things anymore. Her body aches and pains were gone. Her irritable bowel was better. Her chest pain, the tightness she would get at a time when she would have anxiety. She would have anxiety and she would hyperventilate and she would get chest tightness, which sometimes when you have anxiety leads people to go to the emergency room. ER visits are very common with anxiety attacks because people think I'm having a heart attack, I'm going to die, I'm going to stop breathing. Or if they have bad headaches, I think I might have brain cancer. I need to get a CAT scan. So people often go to the ER for reasons of anxiety. It drives them there because they can't. They say I'm going to die. I have to go, or I'm going to. So they go. They spend a lot of time and waste money there, and go home with They say everything's fine. Your EKG is fine. Your scan is fine. Whatever. So, but in her case, all those are better. She was shocked. The only thing she said was, and by the second or by the third visit, she said, "I'm still feeling great. My anxiety is still gone, but I'm a little bit tired. Not as apathetic as I was, with the Prozac, but a little bit. I just don't have my old zip, and I just. So again, if you've been watching the show, you know what I'm going to do next. I added Wellbutrin. And I put Wellbutrin, which is the same thing I put her mom on, and with that combination, I call the dynamic duo. So Pristiq Wellbutrin is one of the the most common dynamic duo that I prescribe because they work so well together. And I put that in, and within days of the Wellbutrin, boom, her energy, her motivation's better, her drive is better. So everything is better, and so we go along now. A year passes, and then I see her. I saw her recently, but then the last time I've seen her before that was like 8 months before that. So, and usually I don't let people go that long when they're being treated without seeing me. Usually at the latest, like 6 months. If someone's really stable, then usually can let them go maybe 6 months, sometimes 3 months. Depends on the person. If they're really stable, I'm not making any medication changes, and things are good, we can stretch out the follow-up. But in her case, that's longer than usual. And the reason, because when she came to see me, she said, well, I stopped my meds. And why'd you stop them? And then again, it's something I hear all the time. And again, I don't, the people are already feeling bad enough. It doesn't help if a doctor gets upset about something. There's nothing for me to get mad about. I understand the thinking because I hear it all the time. Well, I just didn't want to take anything long term, or I just thought I was doing so much better, and I've been taking them for a few years now. Well, how long do I have to take these for? And so I explained, I really had a long sit down with her last visit recently and said, look, you got some strong genetics in your family. So it's not just her mom, it's other people in her family history. You were exposed to extreme trauma when you were a child. There's nothing more traumatic to a person than sexual abuse, especially to a prepubescent kid. That causes long-term damage, and people get through it and they get past it, but it still leaves scars often, and so people often need therapy for that. The best kind of therapy is called EMDR, eye movement dysregulation. Anyway, it has to do with eye movement and left brain and right brain. Anyways, you have to be a trained therapist with that method. It works very, very well. It's tough to get through because you have to remember things and talk about them, and but it's kind of like it's a very therapeutic type of treatment for trauma or any kind of PTSD. So anyway, but in her case, it was just more like, well, things are better and things in my life are okay. And so people try to look at their life and say, well, no major stressors are going on in my life. So I figured why take them anymore? Forgetting the fact that how many years, and basically her whole life, she's felt terrible. Since she was a kid, she's really never felt good. When I ask people at the beginning of every visit, I ask the person, when did you feel the best in your life? And the answers are usually either early childhood, like elementary school, before puberty. Because then a lot of people, if they have a really good upbringing in their life, like they have a Mayberry kind of upbringing with, good parents and good supports, and no abuse, and that's can be a very happy time of life. You're playing with your friends. You don't really worry about the future yet, and so it's a good time. The other time people would tell me is maybe late teens, early to mid 20s. Why? Out of the house, maybe early in career, maybe before marriage and kids. Which makes just not to talk that down because a lot of us do that. But it's it complicates things in life. It makes things in life more complex, and so when life's more carefree, so that's why a lot of people say, yeah, that was a good time in my life. So the reason I ask that question is because I always try to later on when I treat the person and get them to remission, which means it gets them completely well. I'll go back and ask them, now, do you feel like you did back here, or do you feel? And when they tell me yes, when they say yes, I haven't felt this good since I was a kid. then I know I had success. And if they say, yeah, I haven't felt this good in 20 years or 30 years or 10 years or whatever, then we call that complete and full remission. Remission means well. And the way to define it is that, or maybe it's not one of those things. And in her case, it wasn't, because she never had that time. She was abused when she was younger. She had an unhappy childhood. She had divorced parents when she was young, and alcoholic mother and all that. So she never really had that happy time. The happiest time, she told me, is when she got treated for the first time. And then she told me later, this is the happiest time, by the second visit of seeing me. That's she didn't even know that was available. She didn't know that. She's like, some people will say, you mean some people feel like this like all the time without taking anything? I go, yeah, fortunate people do. But she didn't understand that, because she, didn't really know what that felt like. And then she did. So then I think what happened over a couple of years of taking it is, like, you kind of take it for granted after a while, and you just started thinking, well, okay, well, then you kind of forget about how you used to feel, and you feel like I've been feeling normal for a couple of years. Isn't that long enough? Now, in some people, they can take things for a while, go off them, and they'll be fine. Okay, but it really depends. If someone has really strong genetics, if they have strong problems and unhappy childhoods or trauma, these are people that are more likely to take things for longer. Lifelong, probably. But you know what? So what? I mean, there's two ways of looking at things. There's a glass half empty mentality. So glass half empty mentality is, I have to take these pills, and so what? People take other pills and don't worry about it, right? So if that's the worst thing, but that's someone who's taking it for granted, and it's like, I don't want to. The glass half full person is saying, like, thank God these medications are around. Thank goodness these are available. Because my ancestors, my grandparents, my great grandparents, they didn't have the luxury of even feeling this way. It's true. So before these kind of medications came about, what did people do? They suffered. What choice did they have? They drank, because that was maybe the only way to medicate back then. Now there's a lot of more choices for people for addictions. But people would smoke, they would drink. What would you do to relieve stress? Do what you can do. So the glass half full people is like, I live in an age and time now that these things are actually treatable, and you take it, and that's a positive way of looking at it. And then people, when they see me after a while, and I give them that explanation, she goes, you know what? So what? If taking a couple of pills and feeling like this, is it that big a deal? There was a patient I saw once who, it's a pretty funny story. But she struggled with this off and on. So when I'd seen her for years, she'd go off, she'd go back on. I'd talk her into doing it, and then she'd go off again. So she came in one time. I could tell she was upset, and she said to me, my opinion is I should not have to take these long term. And I looked at her and I said, you know what? Your body really does not care about your opinion. She got upset. She said, okay, well, I'm going to leave now. And I go, okay. Well, I said, I'm just trying to say that, your body's in charge here, and you're trying to outguess the way your body works, and it's not going to work. And she left in kind of a huff. She called me later. She said, I was on my way home from your office. I was upset at you. I was really mad. I'm like, who is he to tell me it's my body? I can do what I want to do. And so she said, I was at a red light. I looked at my rearview mirror, and I looked at myself, and I started laughing. She said, I started laughing. I said, why are you so mad? He seems to be usually right, in my case at least. So why are you fighting him all the time? Why do you always go in, and why do you always talk to him about going off him? When can I go off him? And so she finally, she went home, she called, she apologized. I said, no need to apologize. And she said, why don't we make a deal? Why? How about if I just keep taking these, and why don't I wait? And if you want me to ever go off them, you tell me. And I go, that's a deal. And by the way, I'll never tell her to go off of them, but that's the whole point. The point is, she finally got to the point. She's like, you know what? I give up. I give up trying to be my own doctor. I give up trying to outguess this. Obviously, I need these things. But again, you got to remember, need does not mean addiction. When people say I need something, people equate that with, well, if I need it, my body must be addicted to it. Well, is the diabetic addicted to their insulin? Is the heart disease patient addicted to their heart medications? Are they, I could go on with examples, but the point is, people don't think, are you addicted to those supplements? Why do you keep taking those supplements long term? Oh, because they're good for me. Oh, they're good for you. All right, okay. Maybe they are. But why do you don't question those? Why don't you go off of those? Well, those are different. Well, they're different because why? They're not a pharmaceutical. They are, you don't have to go to a drugstore where that scary place where they sell drugs. You can get them online. You can get them you can get them from your friend, from a supplier. You can go to GNC or Mother's or whatever. So those don't seem as scary because they're over the counter and they're sold as like holistic medications or naturopathic treatments. Well, I call these holistic because these medications help the body heal itself. They do what the body cannot do on its own. And that's so, you've seen me on my whiteboard when I explain the neurochemistry, how things are moving the wrong way, we move them the right way. Well, if we can fix that and we get things moving the correct way, I call that holistic because what I say is it's helping the body heal itself. That's exactly what these medications do. And when you realize, and people who might disagree with me said, no, that's not holistic. You can't call them holistic because you can only call these medications holistic. Okay, well, you can define it the way you want it. I'm going to define it the way I want it. Not that they're wrong, because maybe I'm sure that some of these things that they take, they give. I take certain supplements my doctor gives me. That's fine. I'm not disparaging supplements and vitamins. I think they're very good for certain people, for sure. But the point is that why do these get such a bad rap? Why do these? Why is there such an anti-medication mentality when it comes to antidepressants, mood stabilizers, ADD medications, whatever? Because people don't understand them, and people think that people read the wrong thing. They go online and research things. They talk to friends and family. I've said it before. I'll say it again. There's three sources of information you never want to get medical information from. Internet. Why internet? Because there's so much misinformation. There's FDA. There's the government's all over the place and giving you warnings and scaring people unnecessarily. Suicide warnings. It's just ridiculous stuff. And so people read that, and if you're already having anxiety and you read stuff like online and you think it sounds real, well, yeah, but it's WebMD. It's a medical site. Okay, they're still regulated. The government still is all over them, and they can only say certain things, and they can't say some of the real things because they're restricted. So internet, bad, okay, really bad. People who blog and they have all these opinions and they're wrong. Number two is friends and family. Okay, why friends and family? Well, obvious reasons. Most of friends and family don't understand this field of medicine, and some do. Let's say it's a nurse, an RN. Okay, well, he or she is really smart. Okay, great. Do they prescribe medication? Oh, they don't. Oh, okay. Well, why would you get? Well, that they're in medicine. Oh, okay, they're in medicine because they're a nurse. Okay, nurses are very important, but what does that have to do with me prescribing this to you? Nothing. Okay, let's say the person in their family is a doctor. Okay, what kind of doctor? A radiologist. Oh, okay, interesting. Well, what medication experience does the person have? Let's say it's a person who does have medication experience. Okay, is that person your doctor? Has that patient taken an adequate history from you? Has that patient treated you ever? It's prescribed for you? No? Okay. Number three, pharmacists. No. Now, pharmacists go to school a long time to learn about medications. Are they clinicians? No, they're not clinicians, meaning they don't prescribe medications. They understand a lot about them, but the problem is with pharmacists is they understand to the point where they think that they have opinions that should matter. They want to be part of the medical team, and they want to, and so they give you these big handouts, these that you can unfold it, and these huge like things like, so they give it to you with your prescription. My best advice, you go to the nearest trash bin and you throw that thing away. Okay, if you try to open that up and read that thing, it's gonna scare you unnecessarily. It's going to completely destroy everything we've done in the office here simply on a handout by a pharmacist. And why the handout? It's government regulations and this and that, FDA and DEA, et cetera, et cetera. So the best thing is to throw it away, like we doctors throw them away. If that thing is attached to samples I give you, I throw that thing away. So there's nothing good that can come from that. If you have any questions, ask the doctor. Ask me. I can give you the details about side effects to look for, all that stuff. They can't, okay? They're not clinicians, and they want to give you advice. They don't want to just put pills in bottles. They don't feel satisfied that they want to do more than that because they went to school a long time. Again, I'm sorry if this means. I know a lot of really good pharmacists, okay, but there's some that just go a little bit beyond where they should, and they start giving medical advice when they shouldn't, and because they're not trained to do so, and so that can be dangerous. And then the problem is also they can talk people into not taking something that is potentially really good for them and could potentially save their life even. So that's why it's not a good idea. And so, but that's why I tell you, I mean, the best medical advice is from the doctor you trust. And then again, we'll give you, I mean, we can be wrong. There can be side effects you don't like, but what do? We can fix it. I mean, we can, but the way is not to try to research it on your own and try to figure it out, because it'll just be frustrating. And it'll also keep you from being treated when you should. I mean, if someone really literally goes and looks up Tylenol or ibuprofen, basic things you might get over the counter, if you start reading about this and getting one of those big handouts, you're probably going to get afraid of taking something like that. So that's the whole point, is because of the fact that that's the government. The government scares everybody about taking anything. If you look at these TV commercials that last like 10 minutes, and there's all these happy people and smiling faces, and then they talk about it, and then all of a sudden, and then tell your doctor, and you could lose your life. Your arm could fall off. You might have uncontrollable vomiting. You could have. I mean, they say all these things that are so ridiculous. The ones now that we're going to see is Vraylar, Rexulti, Caplyta. Those are like three of the modern medications that you're going to see commercials about now. I've prescribed a lot of these medications, and all the things they say on those commercials, I've not seen one of those things once. And I prescribe a lot of medications. And so what does that tell you? It tells you that all those things they're talking about there is scary for no particular reason. But the companies they're forced to do that because of the federal government. And so the government gets involved regulating things, and that's the problem. So the federal government is a problem a lot of the time. And so and they try to play doctor, and we know how bad they are at playing doctor. Just look at what happened with the pandemic if you want proof of that, They're terrible at clinical medicine. I won't name names, but you probably know who I'm talking about. And they did a horrible job during the pandemic with their medical advice, because they're not trained to give it. They're not qualified, and then the results were bad. And the vaccines and everything I could go on about. And if you've heard my podcast, you know how I feel about that stuff. So anyway, that's good for now. And then, but anyway, in her case, going back to her, she finally gets it. I think I had a really good talk with her this last time, and I think she's going to stay on things. So.